Hey, if you're over 60 and you really care about the health of your penis, this is the time to pay attention. Look, I'm Dr. Martina Bianchi. I've been treating men here in Buenos Aires for over 30 years. And if there's one thing I've learned in all this time, it's that the penis doesn't lie. And stick around until the end. Because error number 10 is the most alarming of all, dude. Before we start, I want you to know one thing. This isn't a video to laugh at or to get embarrassed about. This is serious information that can change your quality of life, your health, and even how long you'll be able to enjoy your sexuality. So if you're over 60 or know someone who is, send them this video. You might save their life, I'm serious. And if this content helps you, give it a like so YouTube shows it to more people who need it. All right, let's get to the point. Error number 1, neglecting intimate hygiene. And look, this seems like a no-brainer, but you'd be surprised how many men overlook it. Listen up, penis hygiene isn't just about smelling good or looking presentable. It's essential for preventing infections, irritations, and much more serious problems. Let me tell you about something that happened to me a few months ago. A patient came to my office, let's call him Roberto. 64 years old, a nice guy. Worked his whole life in construction. He says, "Doctor, it burns when I pee and I have a weird smell." I ask about his hygiene and he says he showers every day. But he never paid much attention to that area. He figured the water was enough. Dude, it's not enough. The skin of the penis, especially if you're not circumcised, accumulates smegma, which is a mix of dead cells, oils, and bacteria. If you don't wash properly down there, it becomes a breeding ground for infections. The result, painful inflammations, bad odor, and in severe cases, it can lead to serious issues like balanitis or phimosis. So, what do you have to do? Every day when you shower, gently retract the foreskin and wash with warm water and a neutral, unscented soap. No aggressive soaps or those shower gels that smell like a French perfumery. The skin of the penis is sensitive and overly harsh. Cleaning can cause irritations and small lesions that will bother you more later. After washing, dry the area well, and I mean well, okay? Because moisture is the best friend of fungi and bacteria. The secret is moderation. Keep it clean and dry, but without overusing chemicals. Error number 2, using irritating products. Hey, I see this all the time in my office and it drives me nuts. Guys put anything on their penis without thinking. Perfumed creams, powders, intimate deodorants, cheap lubricants they buy anywhere. You know what happens? The skin of the penis is one of the most sensitive on the body, and with age, it becomes even more delicate. One of my patients, let's say his name is Hector, came in a few years ago with terrible dermatitis. Red as a tomato, burning, itching. He was having a hell of a time. You know what he did? He used a cream his wife gave him to stay young. It had retinol, acids, everything. Dude, the penis isn't the face. It doesn't need anti-aging stuff or nonsense like that. If you're going to use any product, make sure it's specific for the intimate area, without perfume, alcohol, or dyes. And lubricants, please, water-based or medical silicone. Nothing like petroleum jelly or weird oils your neighbor recommended. And watch out for powders. A lot of people from our generation grew up using talc after showering, but it turns out talc can accumulate in skin folds, mix with moisture, and create a mess. Plus, there are studies linking it to irritations and even more serious problems, so avoid it. Error number 3, using inadequate underwear. Listen, I know this sounds like advice from your mom, but it's true. The underwear you wear has a direct impact on the health of your penis, especially after 60. Why? Because with age, the skin gets thinner, circulation isn't the same, and that area needs to breathe. If you wear tight synthetic briefs, you're creating a humid, hot, unventilated environment. That's paradise for fungal and bacterial infections. I always tell my patients, cotton boxers, dude, material that absorbs moisture and allows air to circulate and nothing too tight. If you get home and take off your underwear and have red marks, it's too tight. Come on, buy a bigger size, no big deal. And another thing, change it every day, obviously, but also after exercising or if you've sweated a lot, don't go all day in the same damp underwear. That's a recipe for disaster. Error number 4, ignoring pains, wounds, or bleeding. Hey, this is the error that pisses me off the most. Sorry for the language, but it's true. Men have an incredible ability to ignore symptoms. Oh, it's nothing. It'll pass. Why go to the doctor for something silly? Dude, it's not silly. If you feel pain in your penis, if you have a wound that doesn't heal, if you see blood in your urine or after ejaculating, if you notice any lump or change in the skin, you need to go to the doctor. Not tomorrow, not next week. Now, one of the most alarming signs is blood in the urine or semen. It could be a sign of infection, stones, prostate problems, or in the worst case, something more serious like cancer. And let me tell you, the earlier it's detected, the easier it is to treat. I had a patient, an older guy, 68 years old, who came to see me because his wife forced him. He'd had blood in his urine for months, but didn't want to bother the doctor. It turned out he had a tumor in his bladder. Luckily, we caught it in time, but if he'd waited a few more months, the story could have been very different. So do me a favor. Anything weird you notice, note it down, take a photo if necessary, and come see me or your doctor. Don't be an idiot. Error number 5, not checking the prostate regularly. Look, I know the prostate exam isn't the most glamorous moment of your life. I know, I get it, but listen up. After 50, and especially after 60, you need to get a prostate check every year. No exceptions. The prostate and penis health are connected. An inflamed or problematic prostate can cause pain when urinating, erectile dysfunction, problems ejaculating, and a bunch more. And don't get me started on prostate cancer, which is one of the most common in older men. The check is simple: a blood test to measure PSA and a rectal exam. Yeah, I know it's not pleasant, but it lasts 10 seconds and can save your life. I always tell my patients, 10 seconds of discomfort versus years of life. You decide. And another thing, if you have a family history of prostate cancer, start the checks earlier at 45. Don't wait. Error number 6, neglecting cardiovascular health. Now pay attention because this is important. The penis works with blood. Erections are basically a cardiovascular event. The heart pumps blood, the arteries dilate, blood fills the penis tissues, and boom, you have an erection. What happens when you have cardiovascular problems? Circulation deteriorates, and the penis is one of the first to feel the effects. The arteries in the penis are smaller than those in the heart, so they clog up first. In fact, erectile dysfunction is often the first symptom that something's wrong with the heart. If you have high blood pressure, high cholesterol, diabetes, overweight, if you smoke or drink too much alcohol, you're putting your sexual health at risk. Over time, those conditions damage the blood vessels in the penis, and there may come a time when erections are difficult or impossible. So, what to do? Take care of your heart. Exercise, eat well, control your blood pressure and sugar. Quit smoking if you do. Your penis will thank you, I guarantee it. And if you already have erectile dysfunction, don't give up. Come to the doctor. There are treatments, solutions, but first we need to rule out any underlying cardiovascular issue. Error number 7, self-medicating with Viagra or similar. Hey, this is very common and very dangerous. The guy has erection problems. A friend tells him, "Take this, it works great for me." And he pops a Viagra pill without consulting a doctor. Dude, Medications for erectile dysfunction aren't candy. They have contraindications, interactions with other drugs, and can be dangerous if you have certain health issues. If you're taking nitrates for your heart and you take Viagra, you could have a blood pressure drop that lands you in the hospital. Plus, erectile dysfunction can be a symptom of something more serious: diabetes, hormonal issues, depression, side effects from other medications. If you self medicate, you're covering up the symptom but not treating the cause. In my office, I've seen it all. Guys taking double the dose because it works better, guys mixing Viagra with alcohol or recreational drugs, guys buying fake pills online. It's crazy. If you have erection problems, talk to your doctor. Get the appropriate tests, and if the doctor prescribes something, follow the instructions to the letter. Don't improvise. Error number 8, not maintaining regular sexual activity. Look, this is something a lot of people don't know. The penis, like any part of the body, needs exercise. If you don't use it, it atrophies. It's that simple. When you have an erection, the penis tissue stretches, gets oxygenated, stays elastic and healthy. Nocturnal erections, those you have while sleeping, serve that function. But with age, they decrease, and if on top of that you stop having sexual activity, whether with a partner or solo, the penis starts to suffer. What happens? Atrophy appears, fibrosis, and yes, penis shortening. It's no joke. A penis that's not used regularly can lose size, flexibility, and function. So maintain regular sexual activity. It doesn't matter if it's with a partner or masturbation. The important thing is having erections, getting blood circulating, keeping the tissue active. Don't stress, there's no right frequency. Whatever works for you is fine, but make it regular, not once every 3 months. And if you have trouble getting erections, talk to your doctor. There are exercises, treatments. Don't resign yourself to it's just age. With proper management, you can maintain an active sex life for many more years. Error number 9, not taking care of diet and hydration. What you eat and drink directly affects the health of your penis. If you eat poorly, drink little water, abuse alcohol, you're doing your sexual health a disservice. A diet high in saturated fats, sugars, and processed foods damages blood vessels, raises cholesterol, promotes diabetes. All that impacts your ability to have erections. On the other hand, a diet rich in fruits, vegetables, fish, nuts, olive oil improves circulation, reduces inflammation, keeps arteries clean. It's the typical Mediterranean diet, which, besides being tasty, is great for sexual health. And water. Hey, drink water. Dehydration affects blood volume, makes it thicker, hinders circulation. If you don't drink enough water, your whole body suffers, including the penis. And alcohol in moderation. A glass of wine doesn't hurt, but if you're getting drunk every night, you're damaging your liver, blood vessels, nervous system, and all that affects your sexual function. And now, error number 10. The most serious of all, ignoring changes in the skin of the penis. Listen up, because this could be a matter of life or death. Any change in the skin of the penis, any spot, lump, wart, non-healing ulcer, discoloration, you need to consult immediately. It could be something benign, a simple irritation, a mole, but it could also be penis cancer. And yes, it exists. And though it's not very common when it appears, it's serious. Warning signs are red or white spots that don't go away, lumps or masses, sores or ulcers that don't heal in 2 weeks, warts that grow or change appearance, unexplained bleeding, changes in skin color. If you notice something like that, don't wait. Don't play dumb thinking it'll go away on its own. Come to the doctor. An early diagnosis can make all the difference, and this goes for all guys. Check yourself in the shower or after bathing. Look at your penis closely. Touch it. Check for lumps. spots anything different. Know your body. If something changes, you'll notice it. All right, dude, those are the 10 errors I see all the time in my office. And let me tell you, most are avoidable with a little attention and care. You don't need to do anything extraordinary. Just pay attention to your body and don't ignore the signs. I know that for many of you, talking about these things is uncomfortable. We grew up in a time when this wasn't discussed, when going to the doctor was for wimps, when you just had to tough it out. But look, that mentality literally kills. Taking care of your sexual health isn't vanity, it's not weakness, it's smart. It's loving yourself enough to do what's necessary to be well. And not just for you, but for your family, your partner, everyone who loves and needs you. Use it, take care of it, and give it the attention it deserves. Your penis has been with you your whole life. It's given you incredible moments, kids if you have them. Don't abandon it now. And remember, any doubt, any weird symptom, anything that worries you, consult your doctor. Don't self-diagnose on Google. Don't follow advice from your brother-in-law. Go to a professional. If this video helped you, give it a like, subscribe to the channel, and share it with that friend you know needs it. And tell me in the comments which of these errors surprised you the most. Is there any other topic you want me to cover? See you in the next video.